Digital acceleration is here. Health systems are walking the path, but are they in the right direction? Welcome to Patient Journey Pioneers, roadmaps from the top digital leaders in healthcare, who share insights and strategies that are pushing the patient journey to new heights. This podcast is brought to you by Hyro, and I'm your host, Liat Kosuch. I'm your host, Liat, and today we have Dr. Zafar Chaudry, Senior Vice President, Chief Digital and Information Officer at Seattle Children's. His goal is to enable clinicians with the best technology to deliver safe and excellent care to patients. Dr. Chaudry, it's great to have you with us today.
Thank you for having me.
We're going to have to start with a big congratulations. You recently won the Seattle Healthcare ORBIE Award, Becker's Top CIOs to Know, Top 100 Influential Tech Leaders in the UK Public Sector, and more.
Thank you. Yeah, I'm humbled. It's all down to my team, really. As I say, my team has done a great job of keeping me employed.
But I'm sure you lead with very nice example as well. So tell us briefly about your journey in healthcare, how you got to where you are today, and then we'll dive into the questions.
Yeah, so I've been in healthcare IT now almost coming on 35 years. I started as a physician, my specialty, internal medicine, but I defected quite early in my medical career to the dark side. This was the era of green screens and lots of keystrokes. And they needed clinical people to learn about IT, and I volunteered. And over a period of time, I didn't look back. So I've traveled all over the world. I've worked all over the world as a healthcare CIO, and seen all kinds of versions of healthcare. And what's really interesting to me is people tell me everywhere I go, healthcare is different, but actually it's paid differently, but the challenges are still the same. And I've certainly learned that across my journey, and also had the opportunity to meet people from multiple cultures and backgrounds, and now I'm here in Seattle.
Amazing. What does your role entail today at Seattle Children's?
So the healthcare IT group at Seattle Children's is a team of about 500 people. We do everything from core technology, infrastructure, digital health, clinical information systems, business applications. It's the full spectrum of soup to nuts of IT services, in effect. Mm-hmm. And we're servicing Seattle Children's, which is 46 sites across Washington, Alaska, Montana, and Idaho.
You've implemented Epic in the middle of the pandemic. What are some other examples of things you're working on today at Seattle Children's when it comes to the digital patient experience?
So I think the pandemic accelerated digital transformation at a pace never seen before. I mean, traditionally, physicians and nurses and allied health professionals are reluctant to change, right? Change is always hard, no matter what organization you're in. And I would put myself in the same boat. When I was a physician, I was just as bad when it came to adopting new things, new techniques, new business processes. The pandemic has certainly accelerated that. And so, yes, we were in the middle of putting in an electronic medical record. Didn't know a pandemic was going to happen, but it did. The other thing that accelerated, though, was patient-facing applications. So having a digital front door was key. We had to build that. But what we also learned in the pandemic is that patients don't always have access to the right technology. There is an equity issue. People don't have access to the latest laptop. You know, not every family can buy 5 MacBook Pros or iPhones, and not every family has good internet connections in their homes. So as part of this digital transformation, moving to a strong presence in telehealth, telemedicine, and building a digital front door application, we also built programs to loan devices to those patients, parents, caregivers who didn't have the right access. The devices also had built-in internet capability, because we had to be able to facilitate those telemedicine visits. So that wasn't something we were banking on, right? You know, trying to loan out devices, then hoping they'll actually come back or, you know, be gone forever is a challenge for a health system. But, you know, at Children's, because we deal with kids, equity, diversity, and inclusion is a strong focus for our organization as part of the transformation journey.
That's amazing. I never heard of that. And at a previous Chime forum, you mentioned the equity to have access. So it shouldn't be taken for granted.
No, I think we are lucky, right? Because we have decent jobs, we work in tech,
right.
We have access to devices. You know, it baffles me that somebody might not have an internet connection that's great, because I'm so used to having a great internet connection because I can afford to pay for it.
Exactly.
But in our organization, 53% of patients are on Medicaid, and that means that they're paid through a government program, their healthcare, and that means they're probably low income.
Right. How's it going with the loaning program?
Yeah, it's been successful. Of course, there's always a limitation to how many devices you have and how many you can loan out. We are now learning from our first version of that program and revamping it into sort of version. You always evolve, right? You always learn and evolve. That's being agile. And so we wish we could do more to help the patient population. But of course, there's limitations on funding and equipment availability. Supply chain hasn't been great as well, right? During this pandemic era. So that's also had challenges. And having people to then administer a program is something we've had to spin up. But it's important that people understand that having too much technology, this is still a people business, right? I always tell my team that, we are in the business of patients. We're not in the business of IT.
Right.
And so whatever plans and programs and tools we come up with, we have to make sure that it's available to all. Otherwise, it's not of value. Not everybody's carrying the latest version of iOS in their pocket or Android in their pocket, right? If you're a low-income individual, you're probably buying the pay-as-you-go services for phones. You probably have got the free Android phone that some vendor gave you, right, as part of your contract. And that's not going to be the latest and greatest version, right? And so I think it's important that whatever technology solutions hospitals build, they must take into consideration the accessibility of said application and then how that is actually delivered to the patient. And if the patient is unable to consume, then find ways to help them consume. So the other thing we've done, in addition to loaning out devices, is we did put kiosks at our clinics around the 4 states where if you could drive in and still be able to use the telemedicine function if you didn't have a device or we didn't have a device to loan you.
Wow, I love that. Labor shortage, burnout, service support costs, all these terms, what do they bring to mind? How do you handle these in today's world?
So I think that's a point of discussion for most leaders in my shoes. Staff recruitment and retention is a problem. It's even worse in Seattle. I am competing with technology companies that are literally across the street from my building. That is difficult. But I think we have an advantage. One, in healthcare, most organizations are mission-driven. So when you're working for us, you are really working to help kids with their care and hope, care, and cure for kids. So the mission helps retain staff. In addition, we have done a lot of work in equity measurements across our pay scales. So we've made sure that there is no discrepancy between men and women when it comes to being paid for the same job. We've looked at job descriptions. We've reviewed those. We've compared those to the market. We've made market adjustments to retain people. And, we've done well. We've only got an 8% turnover in health IT at Seattle Children's. That's really low.
That is very low.
So we've done that. We've created we have an employee welfare group within the team called Your Voice. They receive funding from me to do fun events, to keep people engaged, to listen to people. I do frequent town halls and all hands sessions with the teams where they get to anonymously grill me on questions and things that I'm thinking about. That's usually well received. I do updates every Friday to my team where I talk about life. I think one of the most important things for a leader is to humanize themselves with their staff. You know, when you have a big title, people tend to be afraid of having a conversation with you if they work for you, because they look at the title and they see some level of power that scares them off. And what I've tried to do in the pandemic, and it's been difficult for me because I'm probably the biggest introvert you'll ever meet, though you might not say that talking to me. But yes, I'm quite comfortable hiding on the sofa and watching sci-fi and not talking to anybody. But that's really how I grew up and how I am. But at work, you have to humanize yourself with your teams. And I've learned that through the pandemic by telling people your own challenges during a pandemic. You know, being locked up at home for months on end wasn't great for anybody. One of my biggest concerns for my team has always been their mental health, right? Are they all doing okay? So I spend Friday talking about what I've learned, what I've really struggled with that week, you know, what challenges I've had from a family perspective, from a who's been affected by COVID in my family perspective, what I'm looking forward to, what I've watched on TV and what I've learned from that. And, you know, prior to pandemic, I was unable to cook anything. I taught myself to cook. I shared those recipes with the team. People are still alive after trying my recipes, which is good news for me. So I've really tried to humanize the conversation, and I've encouraged teams to reach out for just a chat, whether it's with me or their direct leaders. And it doesn't have to be about work. I've actively encouraged people around the fact that the most important thing in life is family. Mm-hmm. A job is great, and serving a mission is also amazing. But at the same time, if you don't take care of your family, if you don't take care of your own mental health, if you don't take care of your own kids, you will struggle at work. Because those things will be in the back of your head, right? I mean, at the end of the day, you know, no matter what field you're in or what profession you're in, that's your real life. That's how you're going to spend the next, hopefully 70, 80 years of your life. And not, I'm collecting a paycheck or I have a really big title, right? Titles come and go, and the title's valid for the time you're sitting in that seat. But the reality is who are you as a person?
And so who are you going home to?
And who you're going home to, yeah. And I've tried to do that, and I think that's been well received as a conversation, because then people get to know that, you know, you're not the almighty evil person sitting in the chair who's giving them lots of work to do, and everybody's all afraid, right?
Right.
I think you have to humanize it.
Yes.
The most important question I always say to people every day you wake up and go to work, are you having fun, right? If you're not having fun, I tell people, step away from the laptop. Do something else, because you can always come back and catch up your work. But if all you're doing is burying yourself in the laptop, reading email after email, because let's be honest, we all get hundreds of emails a day.
Right.
It's crazy, right? And so that really can make you ill. I mean, I get hundreds of emails. If I look at my inbox and say, oh my God, I have all these emails. Oh, how am I going to make this work? Am I going to fall apart? Yes, I probably will.
And the body gets into stress.
Exactly. So you have to decompress. And a lot of times decompression works well if you're able to talk to someone. And maybe someone that doesn't know anything about you, because then they can't judge you.
Exactly. Are you having fun?
I'm always having fun, right? I say to people, this is the easiest job in the world. And they're like, well, how do you say that? And I said, well, because every day I wake up and I know I'm helping kids get better. What more can I want from life? Every time I walk through the hospital and I see really, really sick kids, it's heartbreaking. But then I also see kids that are getting better and they're smiling.
Right.
One of the best things I've learned in my career is a child is the most resilient person you will ever meet. The 11-year-old kid who is suffering from leukemia, who may not live for the next, but maybe, you know, may pass away in the next 6 months, is still the happiest person you actually meet. They face their pain better than anybody else can. So when I look at those kids, I draw strength from that to say, how can I actually tell you that I'm stressed, right?
Exactly.
I'm fine. I'm healthy. I'm having this conversation with you.
Yes.
The person that should be stressed is the person who's suffering from leukemia,
yes.
or the family that is affected because they may lose their child, right? That is the pain, not, oh, Zafar has 300 emails to answer today.
And I may be one of them.
And you may be one of them, right? So it's pretty irrelevant. So I tend to say that's what gets me out of bed every day.
As someone who's made such a big impact on the industry like yourself, what you learned from that experience that other CIOs can draw from?
So a lot of people ask me the question of what grounds me, right? What was that pivotal moment in my life that really changed how I thought? And I'll take you back to the time when I first became a CIO. It's a proud part of your life to grow in your career, to become a leader, to lead a team of people. The very first CIO job I had, I was summoned by a patient. The patient was 14 years old, and the patient said to me, I want to speak to you. So, I was all new and excited, and look at me with my big title. Went to see this 14-year-old patient, and the 14-year-old patient told me that I had really ruined their life. And I just sat down, took a seat, and said, can you explain what I've done? Right? Because I'm looking at this, I'm all proud of myself. Look at me, I'm in charge. And this 14-year-old kid is telling me I have done something massively wrong to impact his life. And he told me his story. So he was suffering from cancer, and he had 6 months left to live. And as I was sitting there and listening to this story, he said to me that the reason why you've impacted my life is because the Wi-Fi, the internet connection here at my bedside is terrible. And it's terrible. And I want to tell you that my father is a pilot, and he flies all over the world, and he can't be with me all the time while I'm here in the hospital, and I might not leave. And without a great internet connection, I'm unable to speak to him on Skype. I can't see him. I can't talk to him. It breaks. The sound breaks up. The video breaks up. And do you know that I may not see him again if I don't make it? And that was the very first time in my life I realized that it doesn't matter who you are, and it doesn't matter what your title is, and it doesn't matter how much money someone pays you. What matters most importantly is, are you doing the right work that helps people? And that conversation broke my heart. What was the point of me having this big title and this really simple thing that we hadn't focused on and hadn't fixed? And I can tell you that the same day that was fixed. And then I spent the next 6 months or so chatting with this person about the improved experience. And, unfortunately, he did pass away. But that was what I learned, was why I do this job, not for the big title, the big salary, the kudos people are going to, want to talk to you. I think it's most important that everybody's probably facing a humbling moment in their career. And it's what you learn from that. So we're in the service industry. The customer is right. I believe that. For me, the customer is the patient. The customer is the doctor, nurse, allied health professional. So whatever I can do to make their lives easy is how I would define success in my career. Not, it's great to be recognized for it, but that's not important. Because, one day when I'm retired sitting at home thinking about, did I do a good job in my life? That's what I want to think about, not, I got paid a lot of money and look at me.
Right.
And I think everybody gets that moment in their life where something happens that helps them redefine. And I'm glad that happened to me early in my career. Otherwise, I still probably would have had a chip on my shoulder, right? Ego is a problem.
You're only human.
We are human, and certainly the pandemic has taught us that it takes but a few minutes to be gone.
Yeah.
Right? I could have the best role, the best finances, all the awards, big American Express black card, but the reality is, if I'm going to go, I'm going to go. and nobody's going to be able to stop that. And I think people need to take a breath and remember that post-pandemic, that we're only human, we're very fragile, we need to be kind, we need to treat each other with respect and dignity, and we should always help each other, right? At the end of the day, you meet interesting people. I've met you, you're an interesting person, I've learned about the fact that you're halfway across the world. I never would have guessed that. I probably have hundreds of questions about where you live, what it's like, and that would be a different conversation. But do you see what I mean? You can learn so much from each other. I want to be able to help, but I think it does help me do my job better because I have a clinical background, and therefore I understand. I've been on both sides of the fence, right? So I understand when a patient is telling me what we may have done wrong.
Right.
And I also understand what a clinician is telling me that we may have done wrong.
Right.
And so I drive, my digital strategy isn't driven by, my 35 years in healthcare. My digital strategy is driven by conversations. We have a patient advisory group that we meet with every month, and we ask them, what do they need to make their experience from a technology perspective better? And the analogy I'll leave you with is the average 11-year-old knows more about technology than I do. They really do, because they're native, right? They grew up
tech savvy.
When I look at kids and how they're using their fingers on their tablets and phones, and I'm like, I can't even keep up, right?
I wonder what the future CIO will be dealing with. How do you envision a hallway conversation between two healthcare CIOs in 10 years from now?
Well, I think what worries me the most about the future is the loss or lack of communication that we see with the next generation. So the Gen Z being more digital in the way they grow up is they're taking it to the extreme. Everything has to be done on social media. Everything has to be done on texting or iMessaging or WhatsApping, Facebook messaging. That worries me. I think the art, whether or not you're introverted or extroverted, the art of communication is what we are as humans. And so it does worry me that you could be sitting on a sofa and the person next to you, instead of talking to you, will actually send you a text.
Or is just glued to their phone and not looking up.
Or just glued to their phone. And you see that, even when you go out for a meal. You see families and couples sitting for a meal and they're not talking, they're texting, they're on their screen. I think the art of the communication piece needs to be focused on. My worry for the next generation of CIO is, will he, she, they be able to have that level of communication? And sometimes conversations are tough. Sometimes you have to have difficult conversations. And I don't see that with the younger generation of folks. They really struggle to have any form of conversation, never mind a difficult conversation. So I think as people train up to be the next generation of CIOs, I hope that their programs, their educational versus work journey actually includes more focus on communication skills, people skills. And it's become a bit harder with this virtual world, right? Here I am having a conversation with you in 2 dimensions. If we were having it in 3D, there would be a different level of communication. I think body language is something that you learn over time to read, whether you are making a presentation or having a discussion in a big meeting. That's important. And I hope we don't completely stay 100% virtual. We come to a hybrid environment. People interaction is great, but that's not something that's always taught to technologists, right, as I'm sure you appreciate.
If you had $100 million to spend on health tech and no red tape involved, how would you spend it?
I still think that money would be invested in medical equipment and devices that were connected, that actually impacted patient outcome. You're going to get more value from buying a surgical robot training a surgeon to do a new technology with that surgical robot, reducing patient bedtime, reducing patient recovery time, and having better outcomes. That's really where the value is. Because what business are we in, right? In healthcare, first of all, we don't want you to come into a hospital. We want you to remain well. If you come in, we want you to leave and never come back and be healed. The other area I would spend some of that money would be on technologies that support stronger primary care. One of the biggest challenges in the US healthcare system is a lack of access to primary care, which means people tend to get super sick and then end up in the emergency room. I would like to build technologies. I would invest in technologies that looked at chronic diseases, diabetes, hypertension, asthma, and make sure that those kids and even adults are taken care of before they trigger an event that brings them to the hospital. Better diet. So the other thing I would invest in is tools around social determinants of health, right? People don't eat well. That also impacts their health. People don't sleep enough. That impacts their health, physical and mental. So I would also use a chunk of that money on tools for mental health.
A new generation of CIOs. What is the last thing you'd like to leave them with? A piece of advice?
I mean, I would say don't ever forget why you're doing your job. Who are you serving? So spend time with patients, spend time with caregivers, spend time with parents. It is not a technology role, even though you will be enabling lots of, don't get me wrong, I like flashy lights in a data center as much as the next person, but that's not going to be the driver as to why I do this role. And that should be the focus of all CIOs coming into this profession is, why do you do this? What gets you out of bed every day? And if that changes in your career, then you need to seriously think about what that means for you. Because you're not going to work in health IT for the big payoff. You're going to work in health IT because you know why you're doing it. If you're really a technologist who wants a bigger payoff, then you're going to be working in a technology company or building your own startup. And that could be a startup in health, right? But the reality is that's what's going to get you IPO, not working for a not-for-profit mission-based organization. That's just a driver. It's very different. Right. So I would say think about the people that you serve. And in your journey as a CIO, don't forget about family. Don't forget about your mental health. Those are all the things that will keep you grounded to be more successful. Technology is just something we do, right? I don't think if you work in health IT, you wake up thinking about the next shiny box. Hopefully you don't. It's still exciting to see something new built out. If a new software tool comes on board and you get a briefing about it, it's exciting to learn about it. But I don't think that is going to define your success, right? You can put any technology in. And, I could turn a box on today, but that doesn't mean it's actually going to sustain or it's actually going to get used, right? It's like, using simple tools like Microsoft Office. We all use it, right? But we only use about 10% of its features.
Right.
But we pay 100% of its cost. Right? So you walk up to the average person and you say, hey, you were working on Microsoft Word. Did you do a mail merge today? And people look at me like, what? What's that? I've never done that. So that's what you've got to think about, right? Everything you put in, what is the adoption, utilization, and sustainability of that technology? It's exciting. It's like buying a new car, right? Everybody wants to buy a car that's full of technology, 17 screens staring at you. But how many times have you used all the features that you actually paid money for? Right?
Seldom.
Very, very infrequently, right? It's like saying, oh, I've got to have wireless charging in my car. It's a must-have. I have wireless charging in my car. I have to say I've never used it. I've never used it because my phone is always full. I mean, it's so...
Right.
But it was a big point. I had to have that. And healthcare IT is no different, right? As a technologist, you go and see a new demo. I could come to your company and you could show me a demo of something amazing, I'm sure. And I might say, oh my God, if we had that, that would be great. But what I've really got to understand is, does that technology have a use case that is going to bring value? And can I then sustain it in years 2, 3, 4, 5, and beyond? Right. Otherwise, we'll buy it. This is why healthcare organizations have hundreds of thousands of applications, right? We currently have 789 applications. And I scratch my head sometimes to say, yeah, what's the utilization of said 789 applications? Because certainly in my day, I probably used the same 5 things and have been for the last 5 years of being here. So, why have we bought so many of those things? It's like buying a really expensive laptop and then realizing, I just want to surf the web.
Exactly.
Right?
And healthcare organizations should come to realize that.
Yeah, absolutely.
Wow, this has been so amazing. I loved hearing your thoughts. Do you have anyone in mind as a trailblazer in the industry making an impact that you would nominate as a future guest?
So I would definitely nominate my good friend and colleague, Aaron Miri. He's the Chief Digital Officer and CIO at Baptist Health in Florida. And I would certainly nominate him as a visionary colleague, and I've known him for many years, close friend. Yeah,
well,
absolutely.
Thank you so very much for your time. And it was such a pleasure. And I hope to see you again very soon and hopefully in person.
Yes, thank you. It's been a pleasure talking to you. And thanks for taking the time to spend some time with me. And yeah, I absolutely hope to see you in 3 dimensions at some point.
For sure.
Thank you for listening to Patient Journey Pioneers, brought to you by Hyro. Subscribe to our podcast on your favorite listening platform. See you on our next episode.